Dr. Rivera, how young are the patients who get psoriasis? Is this from childhood? Kasi kay Paul, 16 years old, lumabas eh. Anong edad and what are the triggers?
Well, it can affect any ages, no? Actually, we have infantile psoriasis, no? So that young, no? Pero in most cases, we maybe at the age of adolescent, it is already increasing the number of patients that we saw on that we usually see in that age group is already
Mhm.
increasing, and we started monitoring them. Well, of course, no, the more there is such a thing as Kebner phenomena in psoriasis, meaning the more if your skin is kumbaga traumatized, no? So that is kung halimbawa you play sports, kinamot mo, nagkasugat doon sa area na yon. Most of the time, psoriasis starts on these areas. No? So yung if the age group is exposed on activities that will traumatize the skin, the chances of having the psoriasis lesion is higher. So as you increase as you grow older, talagang well, as it depende rin sa work natin. No? So how much your skin received trauma will also be a predictor. And also, I want to share stress. No? So increasing stress will trigger also psoriasis. So age group that receives more stress usually have this experience psoriasis more. And
Okay,
also,
so
I want to
yeah.
answer your first question. No, is this contagious? No, it's not. No, it is immune mediated and genetic, and there are a lot of environmental factors also that can trigger or that can influence uh, psoriasis.
In general, what is the protocol for testing if a patient really has psoriasis and it's not just an allergy, etc.?
Yeah. Most of the time, a board certified dermatologist can diagnose a psoriasis clinically. But there are times that it looks different. No? So if there is a suspicion, okay, of other differential diagnoses, we do biopsy. So biopsy is taking a small portion, a small skin from the patient and have it tested, processed in the laboratory, so we can see in details the tissues. So that's one. No? That's the most. Kumbaga yun yung pinaka-diagnostic for psoriasis, a biopsy.
What are the treatment options regarding psoriasis? Kasi sabi niyo na kanina, some people, Dr. Lichauco, you said some people have the tendency to just buy pain relievers, not realizing that it's not going to solve the problem.
Yeah. So they really need to seek consultation with a specialist to confirm the diagnosis, no? Kasi once we confirm the diagnosis of psoriasis, psoriatic arthritis, I think now more than ever we have better treatment options than before. No, so well, for psoriatic arthritis, pain relievers are just meant to be temporary. They're just there to relieve the symptoms, but they are not meant to be maintenance. But we have a variety of medications that we normally see. If we treat the psoriatic arthritis, it can hopefully also treat the psoriasis or the skin. We have oral medications that are offered, such as methotrexate, that require monitoring, and we have also now what we call injectable medications called biologic agents. And these medications kasi Sito are very valuable because they not only reduce pain and swelling, but it can prevent joint damage. And so, can you imagine if we are able to diagnose a patient early and we are able to start the proper treatment early, we can actually provide a better quality of life because we can prevent joint damage and prevent disability.
Okay, as far as arthritic psoriasis is concerned, when you talk medicine and injections, etc., are these in the realm of 100 peso amounts, 1,000 peso amounts, or kasi alam nyo, because of COVID-19, eh, we've become so accustomed to prices of remdesivir and Tosi and etc. na
Yes.
15,000, etc. For psoriasis, how affordable are the treatments?
Yeah. So the price range is very varied. When we talk about oral treatments, these are the relatively cheaper medications, and so we could say that on a weekly basis, patients may spend around 100 to 150 pesos. But the challenge, though, is that we have to remember that psoriasis and psoriatic arthritis is a chronic condition. It's a long standing condition, and we don't have a cure for it yet. So, our treatments require prolonged therapy. And that is the major challenge here and that is our advocacy actually as a group here. Because the biologic agents, the ones that I mentioned that are the injectable medications, are very effective. But the major challenge is that it's very expensive. And so when we talk about expense, we're talking about around 45 to around 60,000 pesos a month. And that is a very big deal.